Welcome to this session where we will be focusing on bones. Our aim is to identify the different classification and structure of bones, the functions of bones, and the effects of exercise on bones. The skeletal system is divided into two different structures, the axial skeleton and the appendicular skeleton. The axial skeleton consists of 80 bones and refers to those found in the thoracic cage, vertebral column, laryngeal skeleton, and the skull, while the appendicular skeleton consists of 126 bones and refers to those found in the shoulder girdle, upper limbs, pelvic girdle, and the lower limbs. 80% of the entire skeletal system is made up of compact bone tissue, which is also known as cortical bone. This is a dense tissue that is used to produce the hard structure of the skeleton. It has a sturdy calcified pattern with very few spaces and protects the spongy tissue of the bone. The remaining 20% is made up of spongy bone tissue, which is located at the end of long bones. This is a very porous tissue that is rich in vascularization. Combined, the entire human skeleton has a total of 206 bones, which are split into 5 different categories based on their shapes. These 5 categories are long, short, flat, sesamoid, and irregular, which we will go through now. We will first look at long bones. These are hard and dense and cylindrical in shape. They provide strength and basic structure to the body and are found in the appendicular skeleton, i.e., the arms, legs, fingers, and toes. The most well-known long bone is the femur, located in the proximal portion of the leg, which runs from the hip joint to the knee. These bones function as levers, moving when muscles contract. Long bones are made up of 2 parts, the epiphysis and the diaphysis. The diaphysis is the tubular shaft that runs between the 2 ends of the bone, otherwise known as the epiphysis. There is a hollow region in the diaphysis called the medullary cavity, which is filled with yellow marrow. The epiphyses at either end of the bone are filled with spongy bone tissue that contains red bone marrow. A small section divides the epiphyses from the diaphysis, called the metaphyseal plates, which are commonly known as the growth plates. Growth during childhood occurs at these sites. Moving on, we have short bones. These are primarily cube-shaped and are comprised of mainly spongy bone. This type of bone is also found in the hands and feet. The main function of these bones are to provide us with stability and support. Next, we have flat bones. These are shield-shaped bones that predominantly function to protect our organs and also provide large or wide surfaces for muscular attachment. Examples of flat bones would be the ilium, pelvis, the cranium, and the sternum, located in the rib cage. Then we have sesamoid bones. These form within a tendon where a large amount of pressure is generated. They protect tendons as they enable them to overcome a great deal of compressive force. The amount of sesamoid bones vary from person to person, but are usually located in the hands, feet, and knees. The kneecaps are the only sesamoid bones which are commonly found in everyone. Finally, we have irregular bones. These are bones that cannot be classified into any of the previous categories. They offer various purposes to the body, such as providing multiple attachment sites for muscles and the provision of protection for nervous tissue. Some examples of this type of bone would be the sacrum, which provides attachment points for various muscles, and the vertebrae of the spine, which protects the spinal cord. The skeletal system serves an extremely functional purpose in the body. These functions can be somewhat split into 2 different categories, the first being support, movement, and protection, and the second being the storage of minerals and fats and the formation of blood cells. Just as the steel beams of a building provide a scaffold to support its weight, the bones and cartilages of your skeletal system compose the structure that supports the rest of your body. Without the structure our skeleton provides us with, we would simply be mass of liquid-filled tissues. Bones also serve as attachment sites for every single muscle within the body, with each muscle connecting from bone to bone through tendons. Without this, movement would not be possible. A great example of this is the gastrocnemius muscle of the calf, which originates from the distal posterior femur, located at the back of the knee, and inserts into the Achilles tendon, which attaches to the heel. This allows flexion of the foot, which is when the foot points downwards, and it also assists in knee flexion, otherwise known as knee bending. Another structure in the skeletal system that aids movement is articular cartilage. This is a white tissue which is located on the articular surfaces of bones that create joints with other bones. Cartilage allows the smooth transition of bone on bone without pain. An example of this would be in the shoulder joint, which is also known as the glenohumeral joint. The head of the humerus and the glenoid fossa of the scapula both have articular cartilage which, along with various other tissues and structures, allows for the pain-free movement of the shoulder throughout the day. Bones also provide protection for vital organs by covering or surrounding them. If bones fail to protect our vital organs, such as the heart and lungs, during high-impact forces like a rugby tackle, then serious injury and illness can occur. As well as having structural functions, bone tissue performs several critical functions on a metabolic level. For one, bone tissue acts as reservoirs for minerals such as calcium and phosphorus, which are both vital to the functioning of the body. Bones also serve as a site for the storage of fat cells and the production of blood cells. This occurs in a substance called the bone marrow, which is located in the spongy tissue inside the bone. Bone marrow can either be red or yellow. Red bone marrow is responsible for the production of red blood cells, white blood cells, and platelets, while yellow bone marrow contains adipose tissue. The longest structure of bones and joints in the human body is known as the vertebral column, also known as the spinal column, which houses the spinal cord. It is a complex system that serves to function and support every movement in the body. The spinal column is divided into different sections: the cervical, thoracic, lumbar, sacral, and coccygeal spine. The cervical spine is the most proximal portion of the vertebral column, and it consists of 7 vertebrae, C1 through C7. It is located in the neck and is required to be very strong and flexible in order to support the head and movement of the neck. The thoracic spine is the longest portion of the vertebral column, consisting of 12 vertebrae, T1 through T12. Each vertebra provides the attachment site for the 12 pairs of ribs. The lumbar spine consists of 5 vertebrae and is the most common site of back pain, as although it is incredibly strong and resilient, it is subject to high levels of load and stress. The sacral portion of the spine is fused together by 5 vertebrae, S1 through S5, forming what is most commonly known as the sacrum. The sacrum attaches the spine to the pelvis through the sacroiliac joint, otherwise known as the SI joint. Below the sacrum is the coccygeal spine, more commonly referred to as the coccyx. This portion of the vertebral column is made of 4 fused vertebrae. Between each vertebra in the spine, running from between C1 and C2 all the way to between L5 and S1, are intervertebral discs, or for short, IVD. These discs are designed to absorb any force or load that transmits through the spine. The lower discs absorb the most force due to a number of reasons, including gravity, increased anatomical load on the lower spine, and increased lifting motions translating through these portions of the spine. These discs also allow the spine to perform different movements. The spine's main movements are flexion, extension, lateral flexion, and rotation. If needed, the spine can combine a number of these movement types to perform one single movement. The spine has a natural curvature consisting of 3 curves: a lordotic curve of the cervical spine, a kyphotic curve of the thoracic spine, and a lordotic curve of the lumbar spine. A neutral spine should maintain these 3 curvatures, but not increase any of them. This is the strongest and safest position for the spine to be in when sitting or standing. The term postural deviation is used to describe when we stray away from the neutral alignment of the spine. This can develop during childhood and continue into adulthood, but can also be brought on by an imbalance in strength between the different muscle groups. For example, strength training without any mobility training can cause muscles to become tight and therefore distort the body and force the spine to accommodate these imbalances, which results in postural deviation. This can lead to muscular pain, poor balance, and skeletal stress. The growth of bone is a process that begins in childhood and continues all the way through to adulthood. This growth is achieved through a process known as bone remodeling that continues all throughout the lifetime. During this process, the mature bone tissue is broken down by cells called osteoclasts. After the removal of the mature bone, osteoblasts form new bone tissue to allow the bone to grow further. During childhood, bone formation by osteoblasts outpaces destruction by osteoclasts, resulting in growth. Once skeletal maturity has been achieved, osteoclasts and osteoblasts maintain a balance which results in a maintenance of bone density. Then, as we age, our body is unable to produce as many osteoblasts, which means that we are unable to constantly produce healthy bones over time. As a result, the osteoclasts break down more bone than the body can form, and therefore our bones become weaker and more fragile over time. This is why the older you become, the more susceptible you are to breaking a bone or developing osteoporosis as your bone density decreases. Exercise has extremely positive effects on bones. All weight-bearing exercises have shown to increase bone mineral density, especially at a young age. Non-weight-bearing exercise, for example swimming, hasn't shown to have any significant effect on bone density, but it may have beneficial effects on bone elasticity and other bone properties. The overall effects of exercise on bone are seen over a long period of time. These are known as chronic effects, rather than a short period of time, which are known as acute effects. Exercise is shown to prolong and increase bone density, while a lack of exercise has been shown to decrease it. Although exercise has positive effects on bone density, rigorous amounts can have negative effects. As we age, our bones naturally become weaker, so exercising at the level of a 20-year-old when you are 50 may have serious long-term consequences, as your bones may not be able to withstand the repetitive load they once were able to. This, therefore, increases the risk of a stress fracture or other injuries. As well as exercise contributing to bone density, hormones in the body also play a vital role. These hormones are the parathyroid hormone, also referred to as PTH, calcitriol, and calcitonin. PTH helps to support the maintenance of calcium levels in the body. Almost all the body's calcium is contained within our bones. The role of calcium is to help build and maintain bone. Calcitriol is a hormone affected by vitamin D. The more vitamin D your body absorbs, the more calcitriol is released. The function of calcitriol is to allow the intestines to effectively absorb calcium. To ensure the body does not absorb an excessive level of calcium into the blood, calcitonin protects the body from doing just that. It also protects against high levels of bone breakdown, which can cause a decrease in bone density and result in bone disease.